Hello and welcome to the Idaho Reports podcast. I'm Logan Finney. The Idaho Department of Health and Welfare has been in need of a new director since the retirement of Director Dave Jepson. Filling that role now is a familiar name for our listeners, Alex Adams. As you may remember, he served in Governor Little's cabinet as the Director of the Division of Financial Management, now taking over the helm at IDHW. Alex Adams, thanks for joining us.
Glad to be here. Thanks for having me back, Logan.
So you're a familiar name and voice on this podcast, but usually we're talking to you about state budgets and revenue numbers. Can you explain for me what your role in state government has been? Because you've been around longer than just being the numbers guy.
Well, for sure. So was the state budget director under Governor Little from 2019 to up until last Tuesday. So about a 5.5 year run, and what a run it was. I mean, record surpluses, record investments, record tax cuts, the influx of COVID relief, and loved every minute of it, but certainly saw an opportunity to impact lives for the better, which is why I came over to DHW. Prior to the budget shop, though, my background was healthcare. So trained as a pharmacist and had a long line of pharmacists. Dad was a pharmacist, grandpa was a pharmacist, great grandpa was a pharmacist. My wife is a pharmacist. So we joke our daughter's blood type is RX positive, but anymore these days, her favorite word seems to be no. So I'm thinking maybe future budget director instead of future pharmacist. But prior to the budget shop, in state government, I ran the Board of Pharmacy. So it was one of those smaller agencies that license pharmacies, pharmacists, pharmacy technicians, and had quite a bit of fun doing that. So background was healthcare. So in many ways, this is back to the future for me, and look forward to working with many of the same healthcare stakeholders I've been able to interface with in previous government roles.
Yeah, and you also spent a short stint as the interim director for the Charter School Commission.
Six glorious months, but they were 6 good months. We did a complete repeal and replace of both their statutes and regulations, and catapulted in the top 10 nationally in terms of charter school laws.
Yeah, well, that's kind of what I want to highlight. Across all these disparate roles in government, you've kind of got a reputation as a guy who comes in and streamlines things, guy who comes in and cuts red tape. And I think that certainly describes your first week on the job here at Health and Welfare. So can you talk to me about what you've been up to?
Yeah, well, I mean, I obviously had quite a few conversations with the governor about what the role of health and welfare director should be and should look like. And his advice to me was put kids first. You know, when you come to a fork in the road, put kids first. He wants to make Idaho the state where kids and grandkids choose to stay or choose to return. And that's why I've really put a focus on children in some of my first actions. Um, so first minute I showed up with the job last Wednesday, I signed a temporary rule waiving the adoption fees through the department. So for kids that are in the care of the child protection system in Idaho that are adopted through the department, there were previously application fees and home study fees, and I don't want any barriers to adoption for the children that are in their care or for the families that are willing to bring these children into their home. So I thought it would set the tone to start there. Worked with Governor Little. He issued an executive order directing the department to take certain actions as it relates to child welfare. So we did a couple things last week, signed a temporary rule that redefines kin to include foster families. Foster families often develop a significant relationship with the child. In many cases, it's the most significant relationship that the child has. So for a foster family that has been with a child for at least 6 months, we redefine them as being kin to that child. Other thing we did, and this was an action that the Board of Health and Welfare took, was we simplified licensure for foster families. And Idaho, like every other state in the country, has a wait list. We have more kids coming into the child welfare system than we have families to take care of them. I want to reverse that. I want families waiting for children, not children waiting for families. So we did a couple things with the board's approval to simplify foster licensing. First is if a family is willing to step up and apply to be a foster family, I changed the rule that instead of waiting 30 days to take action on it, we would get it down to 1 day. The only reason I did 1 day is I didn't think we could get it down to 30 seconds like I thought it should be. If a family is willing to open their homes to a child, we're going to give them concierge service, and we're going to move quickly to get them licensed and bring them into the system. Second thing it did is it set a policy of licensing families in, not licensing them out. And what I mean by that is we want foster kids to be in safe environments. We want the family to pass background check. We want them to pass all the registry checks, all of that. We want them to have basic safety features, but some of them are related to fire. For what example, you have to have a fire extinguisher. Makes sense, hard to argue with that, but I don't even know that I have a fire extinguisher in my own house. So if the only thing that is holding up a foster family is one of the safety features, a fire extinguisher, the carbon monoxide detector, the fence around bodies of water, things like that, I set a policy that within our budget and within reason, we will finance those things for the purposes of getting families into the system rather than saying, hey, sorry, you would have been a great family for these children. However, you didn't have a crib that met our regulations. Third thing it did is it switched to the national model for licensing foster families, which defers more to foster family judgment rather than having a bunch of ticky-tacky rocks and shoes regulations that they have to fill. It has the background checks, the safety standards, they're pretty common sense, but beyond that, it defers a lot more to the professional judgment of the foster families that we've licensed into our system. Then lastly, Governor had us preview a Bill of Rights for foster parents, setting clear expectations for what foster families can expect and how they'll work with the department. It articulates things like they'll be treated with dignity and respect. They'll have timely communications from the department. They'll have an effective grievance process to redress their concerns with the department. And our goal is to finalize that, make it effective August 1st, but we wanted to set clear expectations for foster families of how they can interface with the department and how our case managers and social workers from top to bottom will be working with them.
Sure, that's certainly, we just over the last legislative session, we've heard a lot of concern about the state of the state's foster care system, and I know it's a longstanding problem.
And, Logan, you're exactly right. I mean, heading into this job, one of the things that excited me about it, frankly, is the challenge that it presented. There are a lot of challenges, and we've heard a lot of those. Legislature's done study after study through the Office Performance Evaluation, highlighting opportunities for improvement. The Legislative Committee on Child Protection Oversight has highlighted a number of opportunities for improvement. And I felt like I was perhaps in a position, having done this at other state agencies, that I could make a difference. I could bring these families together. I could listen to them, hear their concerns, and figure out the levers to pull within state government to get some of those things done. I'll be absolutely crystal clear. Not one of the things that I listed will solve all of the problems. But what I wanted to do is acknowledge to the foster families, I hear you, I see you, I know we can do better, and I know we must do better. And I wanted to generate a little bit of the momentum that would set us in the right direction to hopefully do right by them. These folks are heroes that are willing to open their doors to these children, and they have my undying respect and my commitment that I will always listen to them and look for ways to do better.
All right. Well, speaking of momentum, what is on the horizon for you? We've gone over a lot, but you're only a week on the job, my guy.
Logan, I grew up in a small town in Ohio called Defiance, which my wife tells me is very fitting. Patience has never been my strong suit. So, when I talked to the governor about taking this job, I didn't pursue this job to have the title. I didn't have, pursue this job to have the corner office in a state government building. I pursued this job to do things and to get things done and to make a difference, particularly for children, so that we can carry out Governor Little's mantra, which is getting our children to stay here or return here. So that's been my that kind of summarizes my first week, what we did, but certainly have been focused on other areas as well. A lot of it has been on transparency. So from my previous vantage point as a state budget director, for better or worse, the Department of Health and Welfare is now driving the state budget. It is the largest component of the budget. It surpassed education in total funds in terms of the largest chunk of our budget. So I felt like there were a couple things that we could do to make it a little bit more transparent for our partners in the legislature. So I've ordered 2 monthly reports that will start in July. First is on Medicaid. It'll show the forecast relative to the budget that the legislature set versus our actual expenditures. And why that's important is Medicaid is one of those rare state programs where there's statutory eligibility and statutory services that are required. And legally, we have an obligation to pay the bill for everybody who qualifies and every service that qualifies. That means the budget that the legislature sets is a guess. Now, it's a sophisticated guess, but with economic swings, more people might sign up, or those people might pursue more services than had been forecasted. And I want the legislature to have as much information as their fingertips as they head into the next session to know how that budget is doing relative to forecast. The second report I required is going to look at the other welfare programs that the department administers, everything from food stamps to TANF to childcare subsidies and everything in between. And rather than looking at those relative to forecast, I want to put out the monthly census counts. How many individuals in our state are pursuing those programs, and what was the dollar amount that went out the door? The reason I'm doing that is I think those can be kind of a canary in the coal mine for changing economic conditions, and would have been really beneficial information for me to have when I was in the state budget office in terms of forecasting revenue in the near term. If we see wild swings and uptake in food stamps, for example, that might be the early warning sign that state budget shop might need to build a little bit more pessimism into its revenue forecasting. So thought it would be beneficial both to DFM as well as to the legislature. They have an economic outlook and revenue assessment committee that might be able to take some of that information into consideration as they get ready for rolling up their sleeves and setting the budgets for the next legislative session. Beyond that, been working with our executive leadership team. I did bring in some new folks as part of that team, folks who are veterans within state government and probably are known names to your viewers. For example, I brought in Monty Pro as one of my deputies. Monty previously served as one of the cabinet secretaries under Governor Little. He ran the Department of Juvenile Corrections. And while I love Monty, his goal while running the Department of Juvenile Corrections was to eliminate the juvenile corrections system, to be so effective with prevention, to be so effective with the services that they delivered, that the need for the department was no longer necessary. I need people with that mindset, with that experience in state government, who know how to get things done, who know what levers to pull. So I've surrounded myself with a team that I would compare to the 1992 Dream Team, and folks that I'm really excited about having around me. So a lot of what we're doing is getting to know all facets of the department. No matter how long you work with a department like this or adjacent to a department like this, every day my first week, I found myself saying, oh, I didn't know the department did that, or, oh, I'd never heard of that program.
As a reporter, the number of times I've stumbled across a thing that's, oh, health and welfare is responsible for this. It's crazy.
Yeah, tell me about it. So a lot of it has been getting to know the folks on the team. And, one thing I'll just emphasize is top to bottom, the department is stacked with talent. I've been very impressed with the caliber of individuals who work here. The number of people I've met just doing some rounds who can say that they've been here 10, 20, 30 years. Frankly, I've met some people who have worked for the department literally longer than I've been alive. That speaks to the caliber of individuals who are coming to the department. It speaks to their motivations. These are people who pursued the department as a calling, and I want to advance that calling and give them the tools and the resources they need to be successful. But it's certainly one of the challenges with a department this size is just, the more any leadership team tries to do, the less effective they'll be. And conversely, the less you focus on, the more successful you'll be. And that's why I've really sharpened my focus on child welfare. I've been telling folks I've got 3 goals for the department: improve child welfare, improve child welfare, improve child welfare. That doesn't mean that any other area of the department isn't important. It doesn't mean that the day-to-day work won't continue. It doesn't mean that we won't elevate and promote the individuals who are in other areas of the department. It just means where this leadership team is going to spend its disproportionate amount of time and its disproportionate amount of energy is on improving child welfare outcomes. And it also means when we come to a fork in the road as it relates to resources, our priority is going to be child welfare.
As we've kind of acknowledged, health and welfare is a very big department of one of the state's many departments. It's gone from the second largest to the largest factor in the state budget when lawmakers convene and write that every year. I hear almost daily we need to get the Medicaid budget under control when lawmakers are in town. What's the relationship like between the legislature and health and welfare? We've seen tension between them and the budget committee over intent language about grants. We've had investigations by the attorney general's office. It's kind of been in the news a lot. Is that because there's issues? Is that because it's just such a big sprawling department? You're the one who was sitting in JFAC every single day when the cast of reporters was rotating in and out. You talk to me about the relationship between the agency and the lawmakers.
Certainly. I mean, Logan, I don't think what Idaho is experiencing is different than any other state. Departments of health and welfare were some of those back end agencies that interfaced with a lot of members of the public, but we're not forward facing agencies. And then COVID changed the name of the game for state departments of health across the nation. It elevated them from those back end agencies that were doing meaningful work to frontline parties that often were on the news daily. And with that, it comes a different level of scrutiny. And, a lot of my message to the team is we need to invite that scrutiny. We need to welcome that scrutiny. For us to do our jobs well, we have to be comfortable telling the legislature what we're doing and why we're doing it. So a lot of the policy I've talked about with my leadership team is I want to look only at the road that's in front of us. I don't want to look through the rear view mirror. Certainly, we're going to learn from the past. We're going to learn from what worked well, what didn't work well. But I don't think you'll ever hear me criticize anything that happened in the past because, frankly, it's a lot of good people who made decisions based on the information I had in front of them at the time. And I don't want to let my benefit of hindsight cloud the judgment of good decisions that people made at that time. So I do think there does need to be a little bit of a reset with the legislature, but I don't think that's unusual for any health department in this post-COVID environment. And hopefully some of the legislative relationships that I was able to make through the budget shop can be useful in communicating the what and the why of what the Department of Health and Welfare is doing.
Okay, well, we'll ease off on the politics a little bit and shift back into the policy. A lot of the health and welfare spending and programs and budget is federal mandates that the state doesn't have a whole lot of control over. How much of a handle do you expect to be able to get on the health and welfare budget, especially now that it's directly under your management, not just through the budget process as a whole?
Certainly. I mean, the health and welfare budget is different than darn near every other budget in the state, with the exception of education. Health and welfare and education have statutory overlays that compel the provision of certain services, and anyone that shows up and meets that eligibility criteria is by law eligible for the services, regardless of what the budget committee had forecasted. So the state has the ability to opt into these federal programs. Once you opt in, you're under the federal requirements as well as the state requirements for the program. So a lot of the growth in the departmental budget is non-discretionary in nature. It's statutorily required, and there's not a lot of levers that can be turned because it's required under state law. So I think a lot of what you're going to see me do is educate lawmakers on what those knobs that are available to them to turn and how they can turn them, and versus which of those are federal dictates that just come along with doing the program. I am, I say humbly, I'm inheriting my greatest fear as a former budget director. I'm inheriting some budget deficits. I inherited a budget that's in the red for both child welfare and for children's mental health. So with a great dose of humility, I'll be back in front of JFAC with many of my former colleagues next year, explaining why we were in the red and what steps we're taking to mitigate that in the future. Child welfare is the most in the red, and the reason it's in the red is we have fewer homes available for children than we have children in the system, and therefore we've had to rely on short-term rentals, congregate care, and other settings that are orders of magnitude more expensive than in-home care, and frankly have worse outcomes than in-home care. That's why you see me focusing on that a lot. Medicaid, you'll see me focus on a little bit, but right off the bat, We're victims of our own success. The feds match every dollar that the state covers, but the rate that they cover it is inversely proportional to your economics. The better the state does economically, the lower the share the feds will cover. And under Governor Little, the state is on an incredible economic trajectory. We rank first or second in most major categories. The one that's most germane to Medicaid is personal income growth. As personal income grows, the share that the feds cover decreases, and our personal income has grown significantly in recent years, both with the tax cuts, the types of jobs that we're attracting, the quality of life and living that we have in Idaho. Personal income is going up faster than darn near any other state in the country, which means the share of the Medicaid bill we have to cover from the state also increases. I've seen estimates that it would be up to $70 million heading into this next year. And to the extent that that proves true, frankly, there's no levers that we can turn to adjust the federal share. So a lot of it will be talking to the legislature about what levers we can control and what we can't control, and why, in some regards, we're victims of our own success.
All right. Well, luckily, we've still got a long ways to go before the next legislative session. You're a busy man, so we'll let you get back to work. Director of Idaho Department of Health and Welfare, Alex Adams, thanks so much for your time today.
Thanks for having me.
Presentation of Idaho Reports on Idaho Public Television is made possible through the generous support of the Laura Moore Cunningham Foundation, committed to fulfilling the Moore and Bettis family legacy of building the great state of Idaho, by the Friends of Idaho Public Television, and by the Corporation for Public Broadcasting.